With me now is Suzie Bailey, who is Director of Leadership and Quality Improvement at NHS Improvement. Hello to you.
Hello.
Now, what's the main focus of what you're saying at the conference?
Okay, my main focus is around the importance of leadership and developing good teamwork, and that's where the patient is part of the team.
Now, you'd think that sounds like motherhood and apple pie, that everyone would be doing that anyway.
You would, but actually the art of real teamwork does need practicing. It's about the opportunity for a team to reflect, it's about having good data, and it's about being really clear about the objectives that a team is working on. And sometimes that can get lost in the myriad of things that teams are trying to deliver in healthcare.
So how good do you think we are at leadership and in the NHS?
I think we've got some fantastic examples of leadership in the NHS, and I think when we talk about leadership in the NHS, we need to understand that leadership happens at all levels. Often the focus can be on the most senior level, so the chief executive level, and that's an important role, but actually leadership needs to happen at every part, and that's what we call collective leadership. So that's how we distribute leadership, so that every member of staff understands the responsibility they have.
And how do we get to that point?
So how we get to that point is having very open discussions with teams and actually discussing roles and what's important in the team, so what we need to achieve, being really clear about objectives, and also making sure that staff are supported in their role. So do they have the right training, do they have the right equipment, do they have the right supervision? So if they're on a shift, are we actually taking care of them as an individual working as part of that team?
And what's your biggest challenge in achieving that?
So I think the biggest challenge is the pressure on the system at the moment. So the thing that we're talking about today at the conference is how to maintain quality in a pressurized system. The NHS is a very busy system, there's very competing demands, we've obviously got an ageing population, there's lots of reasons why there's pressure on the system. So I think the biggest challenge is helping people to understand the role they have in leadership and understand that leadership isn't something that happens elsewhere, it's not something that somebody else does, that actually as a member of a team you have an important role in leading that team too.
And that's quite a culture change, is it? Quite a shift in, and how do you achieve that, do you think?
It is. I mean, understandably, the NHS has had a culture that perhaps has been a bit more command and control, and there is a place in situations where, you know, direction obviously is important, but actually changing the culture and actually helping people to understand what creates the right environment for staff to do their best work is really important. So actually getting staff talking about the culture that they're creating, what's the environment like, and involving patients in that conversation, because patients are really experiencing that at first hand, so they're an important member of the team too.
Do you think that there is the time to do this extra training, have these extra conversations? I mean, it all sounds great, but aren't people just drowning under the weight of work that they're doing?
I genuinely believe we do have the time to do it, because I don't believe this takes a lot of extra time. I think it is about the day-to-day behaviours that we practice. It was interesting, as I came into the conference today, I was talking to the woman in the cloakroom about what I was going to be talking about, and she said, well, it's about people and behaviour at the end of the day, isn't it? And I said, yeah, it is. It's about the relationships that we have every day. So in every shift, you know, how am I working with you? How are you working with me? How are we understanding the work we've got to do? So I think that's the art of the work. So I don't think it takes extra time.
All right, well, Suzie, good luck with that. Thank you very much.
Thank you very much.